I still remember the time when we met in 2004,
Yeah.
and you invited me to come to your place,
Yeah.
KWA Rotal. And I came with great hesitation in the beginning because I was thinking this is a typical allopathic hospital, and I don't know what will I get inspiration wise going there.
Yeah.
But I still came because you were such a good person, and I thought that you must be doing some good work.
Yeah.
So I came to KWA Rotal, and I was surprised to see that it had a completely different atmosphere than any normal allopathic hospital. There were a lot of people suffering from MS, Parkinson's, and Alzheimer's, and
Stroke.
many stroke, and many neurological problems. And besides allopathic, of course, you had a up-to-date laboratory and all the technological things that allopathic people have. Besides that, you also had a mental therapy room, yoga room, you were doing some other things. How come, I was very surprised and curious that how come you got interested in
Alternative.
complete holistic approach like this?
Well, thank you for the question. I may answer like this. I got a absolutely normal, basic allopathic education at the University Clinic in München called Großhadern.
Okay.
And when I was working at the intensive care unit for a couple of years, I saw that allopathic medicine and surgery is excellent in acute diseases. Maybe you have an accident or you have some bad tumor, things like that, operations, everything were really very much exciting and the results are good. But I also saw that in chronic diseases like multiple sclerosis, like rheumatism, diabetes, allopathic medicine has no healing power. We can treat symptoms, we can improve life quality, maybe we can improve the lifespan for a little bit, but in chronic diseases, allopathic medicine is not the real cure. Also, these medications have side effects. If you have to take it for a long time, maybe you say for cortisone, for instance. So even at that time, I started to look what alternative possibilities in treating chronic diseases are there. So I became to be a homeopath. And after 10 years education in my neurological clinic in Großhadern, I got the chance to become the head of a neurologic rehabilitation center, close to Munich, about 1.5 hours to the east, close to the Austrian border. And there I had a management which allowed me to experiment also with alternative therapies.
Okay, that's great.
Yeah, and it was not long that I got contact to yoga, and we got a cooperation with the Yoga University in Bangalore, and we introduced yoga therapy in our hospital. Then you mentioned in 2004, I got a hint that Ayurveda can also be very helpful in chronic diseases, especially in patients with multiple sclerosis, which were my patients, and I went there. I have undergone some cleaning process in your clinic, Panchakarma, and I was very much impressed by the effect also on my own body. And I was very happy when you said that you would help me to install Ayurveda and Panchakarma with your people, knowing pulse reading and all these things in my hospital. So since 2004, we are now having a very nice cooperation, having doctors of your clinic, therapists of your clinic. We are using your original herbs, your original oils. This is sometimes from the legal process, it is not very easy. But we managed to overcome all this.
Also, you managed to have a cook who makes Ayurvedic food over there.
Now we are more proud that we could have your cook cooking directly in the dining room of our patients. They are so happy to see how this Ayurvedic food is prepared, so they can take it and the recipes and the methods and coming home. So everything is running very nicely.
I know. I know some of the patients from Switzerland, UK, and also Germany who could not come to India. For them, it was like a blessing because they came to KWA Rotal and they found this authentic Ayushakti way of treatment, same, and but they didn't have to travel so long, and the results were almost same like India. So
very
this
good.
was very good.
Besides that, of course, we have normal physiotherapy, we have occupational therapy, all these things. We also have implemented some therapies from Hungary, it's called P2. We have implemented some therapies from Ukraine. It's called neuroactive reflex therapy, which is specifically effective in children with brain problems, maybe birth trauma.
What kind of patients can benefit from coming to KWA Rotal?
Well, primarily, I'm a neurologist, and the clinic I am running is a clinic for neurologic and geriatric rehabilitation. So primarily we have patients with multiple sclerosis, maybe Parkinson's disease, stroke patients, children with neurologic handicaps. However, specifically when they come for Ayurveda, any type of disease is welcome. We are treating patients with rheumatoid arthritis. We have people with Crohn's disease, skin problems, and many others. And most of them are having a nice benefit.
Yes, and I remember some PCOD infertility patients also came to
fertility patients. This can also be treated. We have not so much experience with that now, but this is also a field which would be very interesting.
Yes. Great, thank you.
Thank you.